Hello everyone, welcome to our module on headache disorders. In this video, we'll cover primary headache disorders like tension headache, migraine, and cluster headache with a strong focus on differentiating them clinically and also study about their pharmacology, which is heavily tested on step 1 and NEET PG. I'm happy to let you know that we have now collaborated with UWorld Medical. All of my audience can get a flat 10% off on their medical library subscriptions and bundled medical library and QBank packages using my code Varun10. What is this medical library? So this medical library is a extremely useful, highly organized study resource which is highly integrated with USMLE QBanks on UWorld. They have also come up with an AI-powered tool called UAsk, where you can study smart using the AI prompts. You can learn faster with an integrated all-in-one content and eliminate resource switching and stay in flow. My series are highly synchronous with the UWorld, and UWorld Medical Library is easy to read and understand once you watch my lectures on this channel. You can explore the medical library with the link that is in the bio, and you can get a flat 10% off using my code Varun10 on their medical library packages and bundled QBank and medical library subscriptions. This lecture series is provided free and is open access for everyone if there are no paywalls or mandatory fee. If you find my series or videos useful and wish to support its continued development, you can voluntarily contribute to us with the link that is on the screen and that's also pinned in the bio. You can contribute to us with any of these payment methods. For audience from outside India, you can contribute to our educational initiative using the PayPal QR code that is displayed on the screen. Beginning with understanding headaches as a whole. So, headaches are broadly divided into primary and secondary types. Primary headaches are benign conditions, but before labeling a headache as primary, you should always rule out dangerous secondary causes like hemorrhages, tumors, or infection. So, the key skill for exams is just trying to differentiate them clinically. Primary headaches are benign. Secondary causes includes hemorrhages, tumors, and infection. So these three headaches have very different mechanisms and treatments. Recognizing the pattern helps us immediately select the correct management in questions. So tension headaches are managed using non-steroidal anti-inflammatory drugs and TCAs like amitriptyline. Migraine headache is managed with triptans and CGRP antagonists. Cluster headache is treated with 100% oxygen. Tension headaches are usually bilateral and they are characterized by band-like pressure, whereas migraine headaches are unilateral with pulsating kind and they are associated with nausea or vomiting. Whereas cluster headaches are unilateral, severe with autonomic features like lacrimation and also associated with Horner's syndrome features. Each headache has a unique pattern. This is one of the most important slides with relation to the exams. So if you can identify the pattern quickly, you can eliminate what's the wrong answer in just a few seconds. So tension headaches are bilateral, both sides of the head tight or pressing band-like feel. Migraine headache is characterized by unilateral pain, which is pulsating or throbbing in nature, and this gets worse with activity. Cluster headache is unilateral on one side of the face, usually retroorbital or temporal, and this is associated with autonomic features like lacrimation, rhinorrhea, nasal congestion, and ptosis and meiosis. Tension type headache is the most common primary headache disorder. It is typically seen more frequently in females and is often related to stress. You can read about tension headache on UWorld Medical Library. So this is organized into subheadings like introduction, pathophysiology, epidemiology, clinical presentation, diagnosis, differential diagnosis, management, prognosis, and summary. This medical library is a highly organized study resource. You can get a flat 10% off using my code Varun10 on their medical library and bundle QBank and medical library subscriptions. Just use my code WORM10. The pain in tension headache is described as tight band around the head. It is bilateral and non-pulsating, which helps differentiating it from migraine. Unlike migraines, tension headaches do not have nausea, vomiting, or aura at most. Patients may have either sensitivity to light or sound, but they're not both together in tension type headaches. Either photophobia or phonophobia is seen, but not both of them are seen at the same time in case of tension type headache. There is no associated nausea or vomiting, and there is no preceding aura. Acute episodes are treated with simple analgesics like non-steroidal anti-inflammatory drugs and TCAs like acetaminophen. Chronic cases are managed with sorry, NSAIDs or acetaminophen, whereas chronic cases are managed with TCAs like amitriptyline, chronic like amitriptyline. So these TCAs amitriptyline is used for chronic prophylaxis of tension type headache. Coming to migraine headache, so this migraine headache is a unilateral throbbing headache that can last for several hours uh, till up to 3 days. It is highly disabling and often forces patients to stop daily activities. It is pulsating or throbbing in nature and gets worse with activity. It progresses over a duration of 4 to 72 hours. You can read about migraine headache on UWorld Medical Library. So you can get a flat 10% off using my code WORM10. So it's a highly organized study resource that is organized into different subheadings. It is easy to read and understand. The pound mnemonic is a classic exam tool. If multiple of these features are present, the diagnosis is very likely that it could be migraine. It is so the pound mnemonic stands for P stands for pulsatile, O stands for 1 day duration, U stands for unilateral, N stands for nausea or vomiting, and D stands for disabling. Some patients experience an aura before the headache begins, so this can be visual, like flashing lights, or sensory, like tingling, or sensory hallucinations, like tingling sensations, or paresthesias. So, aura is the most characteristic feature of migraine, and this is present in 25% of migraine patients. Migraine is driven by activation of trigeminal nerve pathways, which releases inflammatory substances. These cause inflammation and dilation of blood vessels in the meninges, which could lead to pain. So, trigeminal nerve activation leads to release of neuropeptides like CGRP, substance P, and neurokinin A, and this leads to neurogenic inflammation and meningeal vasodilation. Whenever there's trigeminal nerve activation, this leads to release of neuropeptides, and this leads to meningeal vasodilation along with neurogenic inflammation, and that leads to pain. Triptans work by activating the serotonin receptors, which eventually causes constriction of the cranial blood vessels and reducing the release of inflammatory mediators. So, acute therapy for migraine is usually with triptans. An example of those triptans is sumatriptan. So, the mechanism of action by how this triptan acts is just this leads to vasoconstriction of the cranial blood vessels, and this leads to reduced release of inflammatory mediators like CGRP. And whenever there is reduced release of inflammatory mediators, there is less meningeal irritation, there is less inflammation and vasodilation. So contraindications of triptans include, so these drugs can constrict blood vessels, so they must not be used in patients with coronary artery disease, previous stroke, or vasospastic angina or transmetal angina. Or other kinds of vasospastic conditions. So triptans cause vasoconstriction and they can precipitate serious cardiovascular events in susceptible patients. So we need to avoid them in patients with a history of CAD, stroke, and transmetal angina. Ergotamine is an older drug with similar effects but more side effects, including the risk of severe ischemia and medication overuse headache. So, this ergotamine is a potent vasoconstrictor. This could lead to medication overuse headache. So, this is one of the side effects, and other side effect or adverse effect includes a risk of peripheral ischemia or gangrene. Ergotamine is effective but has significant adverse effects due to its potent vasoconstrictive properties. If migraines are frequent or severe, preventive therapy is used to reduce the number and intensity of attacks. Topiramate works by reducing neuronal excitability. However, it can cause cognitive side effects like difficulty finding words. So this topiramate enhances GABA, and this GABA increases the inhibitory neurotransmission. Side effects of topiramate includes cognitive slowing, paresthesias, weight loss, and nephrolithiasis. So topiramate is an effective preventive agent for migraine, but is associated with cognitive side effects and risk of kidney stones. This acts by blocking sodium channels and thereby reducing neuronal excitability. Valproic acid is a drug that is effective but must be used cautiously due to serious risks, especially in pregnant patients. So this valproic acid is an effective prophylaxis. This reduces frequency and severity of migraine attacks. Major risks with valproic acid usage could include teratogenicity. This could lead to neural tube defects when this is used in pregnant patients. Uh, so fetus would be born with neural tube defects like spina bifida. This also carries a risk of hepatotoxicity where there is risk of severe liver injury, especially in children less than 2 years of age. And this can also precipitate pancreatitis. Valproic acid is effective for migraine prophylaxis but has significant risks. We need to avoid it in pregnancy and use it with caution because of a risk of hepatotoxicity and pancreatitis. Propranolol helps stabilize neuronal activity but should not be used in patients with asthma or chronic lung disease. We need to avoid this propranolol in patients with asthma or COPD because this may cause bronchospasm and worsen respiratory symptoms. This could also cause severe diabetes. This may mask the symptoms of hypoglycemia, which could lead to uh, this should be avoided in severe diabetes. I've gone wrong. This should be avoided in severe diabetes. This may mask the symptoms of hypoglycemia, like tachycardia and tremor, whatever could be usually seen in cases of hypoglycemic states. So these could be masked. And so patients with severe diabetes, we need to avoid propranolol. Mechanism of action of this propranolol is by decreasing the cortical excitability. It stabilizes the neuronal activity and reduces migraine frequency. This is a beta blocker, which is used for migraine prophylaxis. Propranolol is effective for migraine prevention, but should be avoided in patients with respiratory disease and severe diabetes. Cluster headache is one of the most painful conditions, so it occurs in repeated episodes over weeks to months, often at the same time each day. So this is the most severe headache occurs in clusters. Attacks occur repeatedly over weeks to months, followed by remission. This is common in male smokers. The attacks last for about 15 to 180 minutes. This is characterized by severe unilateral head pain, often around the eye, orbital or temporal. This is the most severe primary headache. This occurs in clusters with periods of recurrent attacks. This is more common in men, especially seen in smokers. So whenever a male with a smoking history presents to you with a very severe headache, that's usually unilateral and often complains of continuous retroorbital pain, which occurs in clusters, which could last for about weeks to months. You need to suspect cluster headache. These attacks last for about 15 to 180 minutes, and uh, these attacks occurs in clusters. They occur repeatedly for few months. You can read about this cluster headache on UWorld Medical Library. It is highly organized into subheadings. It is easy to read and understand. You can get a flat 10% off using my code Varun10. The pain is strictly one-sided in cluster headaches, typically around the eye, and lasts for about a few minutes to few hours. There is severe unilateral pain always on one side of the face. It's retroorbital or temporal. Pain is felt behind the eye or in the temple region. Duration of attack could last for about 15 minutes to 180 minutes or 3 hours. And these attacks occurs in clusters. Cluster headaches are associated with autonomic symptoms on the same side, including tearing, nasal congestion, and features of Horner syndrome like ptosis and meiosis. So, ptosis, that is drooping of the upper eyelid, and meiosis is nothing but constriction of the pupil. And all these features occur on the ipsilateral side or on the same side of the pain. Autonomic symptoms occur on the same side as pain. They result from activation of the trigeminal autonomic reflex. Horner syndrome may be present ipsilaterally. High flow oxygen is the fastest and the most effective treatment for acute management of cluster headache. So we can give 100% high flow oxygen, 7 to 15 liters per minute via a non-rebreather mask, and this is the first line treatment. We can also treat those patients with triptans, where we can give sumatriptan 6 milligrams subcutaneously, or zolmitriptan nasal spray can also be useful. These are effective abortive therapy. So, most effective treatment for acute management of cluster headache is 100% oxygen via a non-rebreather mask. Treat early for maximum effectiveness. Attacks usually respond within minutes. Chronic or preventive treatment is usually done with verapamil. So verapamil is a first-line preventive therapy for cluster headaches or for prophylaxis. It's usually started at 240 milligrams per day, and we need to titrate up till about 480 to 960 milligrams per day, as and when needed, and depending on the tolerance level of the patient. This reduces the frequency and severity of cluster headaches. We need to monitor blood pressure and ECG whenever a patient is being given verapamil because of a risk of bradycardia and atrioventricular block. So acute treatment is with 100% oxygen, and triptans are most effective, whereas chronic treatment is with verapamil, which is a first-line preventive therapy. And whenever patients are prescribed verapamil, we need to monitor blood pressure and ECG regularly. Now, let's just try to quickly revise and summarize everything that we have learned in this module. So, tension headache is a band-like bilateral pain lasting for about 30 minutes to 7 days. This is usually mild to moderate. There is no associated nausea or vomiting. There are no autonomic signs. Treatment is usually with non-steroidal anti-inflammatory drugs, acetaminophen, and TCAs like amitriptyline. This can be managed with rest and management of stress. Migraine headaches are usually pulsatile or throbbing in nature. Their unilateral duration could last about 4 to 72 hours. Features of migraine headaches includes nausea, vomiting, photophobia, phonophobia, and aura. Treatment is usually with triptans, NSAIDs, and antiemetics. Cluster headache is usually severe unilateral pain that is usually around the orbit or behind the orbit, usually retroorbital. The duration of attack could last for about 15 minutes to 3 hours. Features of cluster headache includes autonomic signs like tearing, rhinorrhea, nasal congestion, Horner syndrome. This can be treated with 100% oxygen, triptans, and verapamil. Verapamil can be used for prophylaxis. Triptans are the first line for acute migraine attacks. 100% oxygen is the first line for acute cluster headache attacks. So use prophylactic agents for frequent or severe migraine and cluster attacks. The key takeaway from this module is that we need to know the pattern, whether unilateral or bilateral, the duration of the attacks. We need to identify the features, and we need to treat it appropriately. For example, migraine is usually the prophylaxis is usually with triptans, whereas prophylaxis of cluster headaches is usually with CCB like verapamil. I hope this video helped you. In the next video, I'll be right back with a module on neurodegenerative disorders and dementias. Till then, I request all of you to subscribe and keep supporting. Thank you so much. Bye.